Are doctors rich?
Number 1, Dr. Patrick Soon-Chung.
Hey interns, I'm Dr. Chris Raynor, and I am not your everyday ortho.
Ladies and gentlemen, can I please have your attention?
Today, for Orthopedic Rounds, we are talking about whether or not doctors are rich.
Bro, what are you talking about, man?
I know that this is not necessarily an orthopedic topic, but it is really a good question. If this topic isn't for you, you can watch one of my other videos where I talk about sports injuries right here. I would appreciate if you support the channel and show the algorithm that you dig what I do. Otherwise, let's get to the topic at hand. Before we get started, there are a few things to note. First, I'm going to answer this question as a doctor in Canada because that's where I live and practice. Also, there are many types of doctors with very disparate incomes, so I'm going to talk primarily about my own specialty, orthopedic surgery. Furthermore, while there are many ways to interpret wealth, for the purposes of this discussion, I'm going to be talking about monetary wealth. Although I do acknowledge that there are other types of wealth that are certainly of equal or even perhaps greater importance. In 2019, the provincial government of Ontario, where I live, released the billing information of all physicians registered in the province. In Canada, where access to medical care is universal, most physicians are paid by their provincial government on a fee-for-service basis, where doctors are paid based on the services that they provide to patients for the government. This means that the government has intimate knowledge of the amount that physicians bill and earn. In the 2019 publication for Ontario, the billing for orthopedic surgeons ranged from approximately $300,000 to $800,000 annually. So, even at the lowest reported income, this puts orthopedic surgeons in Ontario within the highest earning 10% in Canada, where the average income is $125,000. In fact, since the Canadian government reports that the average income of those in the top 5% is $179,000, and those in the top 1% is $381,000, the bottom orthopedic income earners are within the top 1 to 5% of income earners in Canada. So it certainly appears that orthopedic surgeons are killing it, right? Video's done, drop the mic. But wait, I forgot to mention something that will change our numbers a little bit. The numbers reported by the government referred to physician billings that were paid by the provincial government. These are the pre-tax billings and do not include expenses incurred by orthopedic surgeons. In Ontario, most orthopedic surgeons run their own offices. They are responsible for all of the overhead costs that are associated with the office, including the rent, utilities, medical supplies, and the salaries of the admin staff, nurses, physician assistants, and technicians if any are employed. All of these expenses are paid from the revenue from billings, and typically those expenses range from 25 to 30% of the total billings regardless of whether or not the surgeon is working. So this means that while the Ontario surgeons will bill between $300,000 and $800,000, they will only see $210,000 to $560,000 before taxes. Still, not too shabby. But let's talk about taxes to see how these numbers are affected. In Canada, the federal and provincial governments use the marginal taxation system, where the more income you earn, the higher income tax you can expect to pay on each tier of income. In Canada, income earners can expect to pay 33% in federal income tax for earnings over $214,368. At the provincial level, the highest income earners in Ontario can expect to pay 13.16% on income over $220,000. This equates to a combined marginal tax rate of 53.53%. So, while the calculation of income tax can be quite complex depending on the tax bracket and the type of income earned, we can generalize for the purpose of simplicity and say that orthopedic surgeons in Ontario are taxed slightly more than half of their earnings. This leaves orthopedic surgeons walking away with $100,000 to $263,000 after taxation. Nice! So, I can drop the mic now, right? Well, let's consider a few more factors. The absolute shortest length of time required to become an orthopedic surgeon in Canada is 11 years. 3 years of undergraduate education in the degree of your choice, 3 years of medical training at McMaster University, and 5 years of orthopedic training, after which time you could be employed as an orthopedic surgeon.
Don't think so.
However, most orthopedic trainees also do at least one, if not more, fellowships, and many do not take the route described here. For most, their path is anywhere between 13 and 17 years of training. Although some of this time includes paid training, this is an extended period of time where trainees are not earning as orthopedic surgeons. This is important for two reasons. First, there is an opportunity cost that is associated with training to become an orthopedic surgeon, where the trainee could have been working in some other job earning an income, but they were not. On average, the orthopedic trainee misses at least 8 years of earnings, if not more, while training to become a surgeon. That is a lot of years of earnings. The second important reason is that it is not unusual for orthopedic trainees to have incurred considerable debt prior to and during their medical and orthopedic training. These days, it is not unheard of for residents to finish their training with debts ranging from $400,000 to $500,000. Even if you applied every single dollar that orthopedic surgeons make toward paying off the debt, leaving nothing left to live off, it still would take several years minimum to pay these debts off. I myself owed approximately $500,000 upon the completion of my studies. It took me approximately 5 years to pay this off. With an extended duration of training before surgeons can begin working, there is a reduced amount of time remaining over which to generate income to repay debts. While orthopedic surgeons make a lot, they also owe a lot. Is it too late to reconsider careers? Another thing to consider is the hours involved in earning the income. The average person works approximately 40 hours weekly between 8 to 4 or 9 to 5. Evenings and weekends are usually free. The average orthopedic surgeon works about 45 to 50 daytime hours weekly, during which they are in clinic or in the operating room treating patients. In addition, they are typically on call and in the emergency department or operating room after hours every 4 to 7 days and 1 or more weekends a month for an additional 12 to 32 hours weekly. At a minimum, the average orthopedic surgeon invests about 60 hours weekly towards their bottom line. But in extreme cases, surgeons can spend upwards of 100 hours per week working or performing work-related tasks. With the average surgeon working between 48 to 50 weeks a year, this equates to approximately 3,000 hours worked annually. Based on the after-tax earnings, this means that the orthopedic surgeons net from $33 to $87 hourly, depending on how hard they work and the amount of patients that they see. Obviously, in a fee-for-service system, the more they work and the more patients that they see, the more money that they make. Which leads me to another aspect of having a career as an orthopedic surgeon. In general, physicians in Canada are independent contractors with a single payer, the government. As independent contractors, we do not have medical benefits, we do not have insurance provided for us, and we do not have a pension that is provided for us by the government. We are expected to cover these expenses ourselves. This means that while working, not only does a physician have to earn a living, pay down their debts, and cover the expenses associated with running their office, but also that they must accumulate enough savings that they can eventually retire at a reasonable age, rather than continue working until death. Clearly, there is an incentive for physicians to make as much as they can with their working hours so that they can look after themselves once they retire. Remember the reduced income earning years as a result of the extended duration of training? That applies here too. Less time available to repay debts also means less time available to accumulate a retirement nest egg. I can think of more than a few surgeons who have continued working well into their 70s and in some occasions into their mid-80s.
Bro, what are you talking about, man?
While I want to remain active until I die, I am not interested in slaving away until my last breath because I couldn't afford to retire. Preparation for retirement takes careful planning and diverts funds that may be otherwise spent on living today, like now. Don't get me wrong. I'm not whining. I love what I do and I am happy with my life. So what's the bottom line? Are doctors rich? I would have to say that in terms of dollars and cents, when compared with the average person, orthopedic surgeons at least are indeed rich. Our wealth is not on the same level as professional athletes, entertainers, entrepreneurs, or corporate executives, but it is higher than the average person. However, our monetary wealth does not exactly come easy, and it comes with a price that many would not be willing to pay. When you consider the hours worked and the hourly rate earned, the picture begins to look less rosy. In the end, it's all about perspective. Is orthopedic surgery a career for you? That's a topic for another video. If you like this video, then subscribe to the channel and become a part of the intern army. Hit the notification bell so that you don't miss any of my weekly content. And be sure to share this with a medical student or someone who is interested in medical topics. And of course, don't forget to follow me on my socials. Thanks for watching, and I'll see you for Orthopedic Rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.